Hello, my name is Steve Beetstra. I'm the Dental Program Director at the OSU Nisonger Center. And today we have Braden Gertz, who is the Program Assistant
and
self-advocate here at the OSU Nisonger Center. Today we're going to demonstrate how not to brush somebody's teeth. One of the things that we see often when we teach our patients and caregivers on how to brush somebody's teeth is we have them demonstrate first on how they do it. And often they do it incorrectly. The most important thing when you brush somebody's teeth is you never come from the front. No, Braden, you don't come from the front. And why don't we come from the front? And the reason is because the caregiver's dexterity is not, they don't have the dexterity to brush somebody's teeth safely if they come from the front. So we all brush our teeth kind of like this. But why don't we brush somebody else's teeth this way? Because often what happens is when you brush somebody's teeth this way, you don't know where your toothbrush is in space, and often you will go ahead and you will poke the patient in the palate back here, which is awfully painful. So often we'll have patients who get their teeth brushed from the front are very, very apprehensive of getting their teeth brushed, and the main reason is because it hurts.
Yeah.
Our goal whenever we brush somebody's teeth is to not hurt them, and it's gently to caress the gums and make sure we get all that plaque off, because what do we got to do? We got to protect our heart, and we got to protect our lungs.
Yes.
And we got to protect our teeth so you have a good smile, right?
Yup.
I'm going to demonstrate 2 ways to brush somebody's teeth when you stand from behind, okay? The first way is, what you need to do is you need to gently caress the head. You don't want the head to be moving around in space. No, you don't want that to happen.
No, stay still.
And you can use your finger and retract the cheek and go ahead and when you brush in a circular motion, and you need to brush half on the tooth, half on the gum.
Okay.
Half on the tooth and half on the gum. And when you brush initially, there might be quite a bit of blood when you see it. That's absolutely normal, but if you're consistent about brushing half on the tooth, half on the gum, you'll be able to see after a week or 2 that bleeding will go ahead and stop.
Okay.
So often you need to, if you're able to floss, that's great, but it's more important to make sure you brush somebody's teeth every day.
Oh yeah.
Every day. So when you picture somebody's mouth, you need to picture it as a box. You need to brush the outsides, the insides, and the tops. Okay? So outside, inside, and then the tops. Okay? Same thing on the bottom. Brush the outside, the inside, and then the top. And you should brush for around 2 minutes. I mean, I love the mechanical toothbrushes that have a timer. And 2 minutes is the appropriate time, and it does 2 things. One, if you're using a fluoridated toothpaste, it'll allow the fluoridated toothpaste to stay on the teeth for basically 2 minutes, which helps remineralize the teeth to allow for that, if you have the start of a cavity, to help get it hard again, so hopefully we'll never have to do a filling.